Back, you're still watching The Globe. The Nigeria Center for Disease Control says the cholera epidemic has killed 1,178 people in 24 states, including the capital Abuja, since it broke out in January. The health agency says that 37,819 suspected cases of cholera were reported from 24 states as of Saturday. Now, the NCDC says that there has been a decrease in the number of new cases in the last 2 weeks. Cholera is an acute watery diarrhea that can lead to death by severe dehydration. The outbreak is frequently reported in Nigeria due to the lack of potable water supply, especially in densely populated areas. For a little more on this, we're now joined by Dr. Yahya Disu, who's the head of Risk Communication Division at the Nigeria Center for Disease Control. Thank you very much indeed for joining us. Welcome to the program.
Thank you. Good evening. Thank you for having me.
All right, let's give our viewers a little bit of an understanding in terms of what cholera is and how does it spread that it is so dangerous to see so many people dying.
Well, cholera is a diarrheal disease, and that is passage of frequent watery stools. Sometimes is accompanied by vomiting, and it is caused by bacteria called Vibrio cholerae, and it is transmitted through contaminated food and water, especially when there is poor hygiene, poor sanitation. Because when fecal matter contaminates food substances or drinking water, and if it contains this bacteria, the risk of getting cholera is very high. So when it starts from contaminated food, it can also spread from person to person. And the problem with cholera is sometimes, most times, it comes with dehydration because someone starts passing frequent watery stool and the person becomes dry, and people die easily from dehydration that results from the frequent stooling and vomiting. So that is cholera.
How has it managed to travel to 24 states so quickly?
Well, we could say this could be as a result of poor access to drinking water. And then we usually see this during rainy season when there is flooding, and flooding can bring contaminated water due to waste, and then where people practice open defecation, and then especially in the rural areas. So the flood brings the contaminated water in contact with the water that people drink or use to cook food. So, and that is why you see it in many states of the Federation. Because it is rainy season, and this is the time of the year we usually see this.
Is there a vaccination, preventative measures one can take?
Yes, there is cholera vaccine, but this is the last resort. Because the vaccine, if you take the first dose, it can last you for 3 months. The second dose will last for about 3 years. But we don't really rely on the vaccines because the vaccine cannot go around, because cholera outbreak is usually a massive outbreak. And so the most important thing is to prevent it from occurring. So by ensuring there is good sanitation and good access to potable water. And then when there is cholera outbreak, essentially what we do is we ask people to chlorinate or decontaminate their environment, chlorinate their water, cook their food very well, so that even if there is bacteria in the food or in the water, it will kill it. So they need to drink boiled water. The water should be boiled, and then personal hygiene. When people go to the toilet, they come back, they wash their hands. For those who are having cholera, they need to take a salt water solution in order to rehydrate themselves. Because most times before they get to the hospital, they may die. So, but if they keep rehydrating themselves and they get to the hospital, the chances of survival is very high.
So right now, is it escalating, or have you managed to at least stop the escalation?
The escalation, according to the curve, the epic curve, the number of cases are coming down, and then the number of states are also reducing. So it seems to be coming down because there is enough awareness, and even the people themselves, everybody knows that, oh, there is cholera, and the response has been scaled up in all the states, and the public health response at the national state level being deployed.
So sadly, it sounds as if this is something that will keep coming back time and time again.
Yes, obviously, this is a lesson we are learning. We need to ensure that we have adequate infrastructures, facilities that will ensure people don't defecate indiscriminately, and then also ensure that there is potable water, good drinking water, particularly during rainy season. And enough awareness needs to be created so that drains will be cleared, and that will reduce the impact of flooding. With the climate change, and this will also be as a result of climate change. And that's why we are seeing the flooding that is escalating the cholera.
How has COVID-19 impacted on dealing with an epidemic such as cholera?
Well, we can't really say COVID-19 is the one causing cholera, but because the same healthcare workers that are responding to COVID-19 are also the same healthcare workers that are responding to cholera. So the healthcare workers are already fatigued, they're already tired. So with the cholera outbreak, they are overwhelmed. So I think that is the way I feel it may affect this. But then, if you look at what COVID-19 has done to our health system, it has actually upgraded the health system. We have laboratory facilities in many of the states. More healthcare workers have been trained on infection prevention and control. High index of suspicion among the healthcare workers about infectious diseases. So it should actually encourage or promote ability to respond to this. And even the anti-gene that is actually promoted during COVID-19 pandemic, and it should be an extension of benefits of that, because anti-gene too is supposed to help in spreading the disease. But then, if the water is contaminated, no matter what anti-gene you perform, because you drink the water straight. So how can we prevent our water from being contaminated, and how to also ensure the ones that are contaminated, they are disinfected through chlorination and then boiling?
What is the situation in terms of COVID-19? I see that, for a population of 200 million plus, 183,000 cases have been confirmed. Is that significantly underreported, or that is genuinely the case?
Well, we believe there are cases that are not reported, because when it's about reporting, it's also about the people who accept that this disease is real. And you see a lot of people who are still in denial. They will tell you that this is malaria, it's not COVID-19. But for those who report, the data are actually captured. But we continue to do risk communication, create awareness, encourage people to report, to go to facilities where their samples can be collected, and so that they can be tested for COVID-19. But one way we also monitor the magnitude of the outbreak is looking at the test positivity rate. So when the cases are down, and we see that the test positivity rate was also down. So when it is high now and it is also going, at then time we'll know that there is actually active transmission.
So what is the state of play at the moment? A lot of African countries are busy dealing with a third wave. Is Nigeria also on that?
Yes, we are dealing with third waves now. Cases are going up, and the number of states reporting cases are also increasing in Nigeria. More importantly, we also have Delta variant in Nigeria, And then we have reported that in some states. And in one of the states, the major variant in circulation causing transmission is the Delta variant.
And with a massive population such as yours, the vaccination program is going to take a long time.
Definitely, we know that. That is disadvantage of having a huge population. And then, unfortunately, we don't manufacture the vaccine, so we have to depend on importation. Nigerian government has made preparation to ensure that the vaccine gets to the target population latest by 2022. So there is a plan to vaccinate Nigerians. But then to make it more effective, there is a plan for vaccinating people who are most vulnerable, and then before they move to the general population. So at least we can safeguard the lives of the vulnerables in the population.
Is cholera then a comorbidity when it comes to COVID-19?
We cannot really say, because cholera is an acute disease. When it happens, people can die in hours. So when you ingest contaminated water, it takes few hours before you start manifesting. So it may not. You cannot say. But once cholera comes, whether you have COVID-19 or not, and if you are dehydrated and you don't rehydrate yourself and you don't get proper treatment on time, and then definitely somebody is going to die.
And this doesn't discriminate on an age basis, young, old, everybody is vulnerable to cholera.
Everybody is vulnerable to cholera. But because of immunity, people are younger. Usually you see them suffering from the disease more, probably because they play together and then they take some risk. And in some rural areas, you see some children who go to the stream. But we see it more in younger population.
Well, we wish you the best in combating this current spread, as well as dealing with COVID-19. Dr. Yahya Disu, thank you so much indeed for your time.
Thank you very much. Thank you for having me.